about endodontic disease? We talk a lot about periodontal disease. What about endodontic disease? Let's talk a little bit about this one. This study was really landmark in our eyes, and Brad's going to talk more about this with his cases, but I want to bring it to your attention now before I close. 101 acute heart attack patients, 76% of them were men. They were around age 63 was the mean age. These people were having a heart attack, okay? So they were having a heart attack. They were having an obstructive thrombi, which was evaluated, and the arterial blood was analyzed by PCR for oral pathogens. So they analyzed the blood clot and the arterial blood for oral pathogens. Bacterial DNA load was 16 times greater in the blood clot than in the arterial blood sample. 16 times greater in the clot than in the arterial blood. The oral streptococci was found in almost 80% of the blood clots, and the periodontal pathogens were found in about 35% of the blood clots. That's intriguing. Most frequently found bacteria DNA was from the Streptococcus, mainly Strep mitigis group by about 72%. Most frequently found periodontal pathogens were the AA and again the PG. All right, so this really is valuable because the streptococci have traditionally been the most important organism in these periapical lesions. Oral strep are capable of invading the aortic endothelial cells and triggering the production of inflammatory cytokines and monocyte chemoattractive proteins. The oral strep may initiate or contribute to platelet aggregation in the coronaries. The bacteria originated from the oral cavity is common, and they are phagocytosed and may be translocated in the atherosclerotic plaque or may end up in the plaque directly through the endothelium or on the other side of the artery through the vasa vasorum. So in 30 of these patients, they had panoramic CT imagery. 50% of these patients did show a periapical abscess. If the patient thrombus, their blood clot, these people who were having acute heart attack, if they were positive for the strep viridans DNA, they were 13 times more likely to have a periapical abscess, or an odds ratio of 13%. That's a big, big deal. Dental infection and oral bacteria are associated with the development of a heart attack, and dental health and dental care should be one major element in preventing heart attacks. It's got to be. It's got to be. Our thoughts about this are so strong now that endodontic and periodontal infection may trigger up to half of all heart attacks based on that data. Do you understand that?
As soon as possible, they need to be referred to an oral medicine specialist, somebody who can do sophisticated testing for periodontal disease and endodontic disease, period. That needs to be the standard of care. The periodontal tests were not good. He had periodontal disease, and the dentist called me up, and I said, well, what about endodontic disease? He said, well, he didn't have any complaints about his teeth, and everything kind of looked okay, so I didn't do any testing for that. I said, well, let me send you this recent study. I said, before he gets on a plane to get in here, you've got to check him out for endodontic disease. So he does, and he calls me back a few days later. This is the dentist talking to me. He said, you said to me that you expected him to have a severe abscess or infection in his mouth. He does. I think the dentist thought I had a crystal ball. I didn't have science. You can't beat science. Science works. Science tells you about half the people now having a heart attack probably have this. I didn't have any crystal ball, but he had infection. His lower left second molar is very diseased. You see that? He sent me these pictures. I called him back and said, hey, I think I can pull that one out. Hardly anything holds it in there. So I don't think you even need pliers for that one. But he got him into the oral surgeon that day. He sent him in that day, and it was removed. And he made it to see me. I'm not sure he would have. If that hadn't been done, we'll never know. But I've got some other information on him. Actually, I'm going to go through it, I think, quickly, because it just